Something happened that medicine had never dared before: a complete face and eye transplant. What can it mean to restore not only one's appearance but one's own identity? And how has science come so far as to integrate eye and facial tissues so precisely? What comes after this groundbreaking surgery? Is recovery of sight the next step? Every detail of this procedure is a colossal advance, but the impact of this goes far beyond the surgery. How can this technology change the future of millions living with devastating trauma? Enjoyed this content? Then don't miss out on the other videos on my channel. I'm sure you'll find something that catches your interest. And if you haven't subscribed yet, make sure to hit that subscribe button and turn on notifications. That way, you'll stay updated with all the new content and help the channel grow even more. I'm counting on you. Imagine losing part of your face and an eye in a devastating accident. For Aaron James, this nightmare came true after a 7,200-volt electric shock. But in one of the most revolutionary surgeries in medicine, he received the world's first complete face and eye transplant. This procedure, performed by a team of specialists in New York, is a milestone in the history of transplants. Visual recovery is a challenge, but the preservation of the structure and functionality of the transplanted eye surprises even the most experienced doctors. A giant step for science and a new chance for Aaron. Face transplant surgery is already incredibly complex, but adding an eye transplant to the procedure has taken medicine to another level. Even without full restoration of vision, the fact that the transplanted eye maintains normal pressure and blood flow is a triumph for science. For the first time, doctors have successfully integrated eye tissues, something that previously seemed unimaginable. The hope now is that this breakthrough will pave the way for future interventions that will eventually restore vision in patients like Aaron. The psychological impact of facial loss is devastating, and face transplantation offers not only a second chance at appearance, but also at life. For Aaron, the surgery represented the recovery of his identity. In addition to aesthetics, the transplant brought back motor and sensory functions that are fundamental for daily life. The sensation in the eye and face, while limited, is a sign that the nerves are reconnecting and that recovery is just beginning. This is a real-life example of how science and medicine can turn the impossible into the possible. The challenges that doctors faced in this procedure were immense. Tissue rejection is always a major concern in any transplant, and with the eye involved, the risk was even greater. However, so far, there have been no signs of rejection, something that has left the medical team optimistic. This breakthrough gives hope to millions of people around the world who suffer from traumatic loss. Aaron's transplant could be the first of many, creating a new paradigm in the treatment of extreme facial injuries. This procedure is a beacon of hope for the future. Every progress in the field of transplants brings us closer to a world where complete restoration of vision and facial function is a reality. Aaron's transplant was not only a medical victory, but a symbol of the power of human innovation. We are on the cusp of a new era in which the impossible can be achieved. And Aaron James' story is a testament to this new frontier in medicine. If a complete face and eye transplant was ever possible, what will be the next limit of medicine? How will these innovations redefine the concept of the impossible in medical treatments? And more importantly, what does this mean for millions of people living with previously unsolvable traumas? The question now is not whether science can overcome these challenges, but when the next breakthrough will happen. We are on the cusp of a future where the total restoration of the human body is a real possibility. How many lives can be transformed with what comes next?